Arthrodesis, glenohumeral joint. With autogenous graft, includes obtaining graft. A dorsolateral semicircular incision is made across the glenohumeral joint and carried distally at the midpoint. The articular cartilage is removed from the head of the humerus, ball, and the glenoid cavity, socket. The head is split and a wedge of bone is removed. This wedge is where the acromion will rest when the arm is positioned in abduction. At this point, bone grafting or plate fixation may be added to the procedure to stabilize the glenohumeral joint. If a plate is used, a second procedure will be needed to remove the hardware. Cast application or external fixation may be used in a number of ways. Arthrodesis, open, sacroiliac joint, including obtaining bone graft, including instrumentation, when performed. The physician makes an incision along the posterior 2/3 of the iliac crest, continuing curved around the posterior-superior spine. The soft tissues are reflected to expose the ilium. A rectangular bone window is cut and removed from the ilium. The physician removes cartilage from the sacral surface of the joint, as well as from the joint surface of the block of bone. The physician replaces the block of bone and countersinks it so that its cancellous surface contacts the cancellous bone of the sacrum. The edges of the bone window are osteotomized and the fragments turned inward to secure the block and promote bone formation. The incision is repaired in layers using sutures. The physician may place the patient in a trunk and pelvic cast or brace. Arthrodesis, sacroiliac joint, percutaneous or minimally invasive, indirect visualization, with image guidance, includes obtaining bone graft when performed, and placement of transfixing device. A small incision is made through the gluteal fascia and muscle to reach the ilium. Under fluoroscopic or CT guidance, a pin is placed from the ilium through the sacroiliac joint to the lateral portion of the sacrum. A soft tissue protector is inserted over the pin, and a drill is used to create a pathway and decorticate bone through the ilium to the sacrum. A depth gauge is used to determine implant length. One or more implants may be inserted. The incision is irrigated and closed in layers. Bone grafting and placement of a transfixing device are included in the service, when performed.